The palliative care team provides emotional support. We provide support to the family to help grapple with dealing with the serious illness in the family. And we help to meticulously manage pain and other symptoms like nausea and vomiting or lack of appetite or fatigue, things like that. And the goal of the palliative care team is to have the patient live as well as they can with the illness that they have. Palliative care is not the same as hospice. And hospice is provided when the patient is reasonably thought to be in the last 6 months of their life and they're no longer receiving active treatment for their underlying illness. For instance, someone that has cancer that's being actively treated with radiation treatment or chemotherapy can receive concurrent palliative care for months or years before they reach a point that it's time for them to transition to hospice. You know, there's a lot of confusion of people thinking that palliative care is really giving up. It's not. Palliative care is trying to get the patient to have the best quality of life and support that they can while they're grappling with a serious illness. There was a study published in the prestigious New England Journal of Medicine. All were receiving chemotherapy for their lung cancer, but half of the group was randomized to get concurrent palliative care. And not surprisingly, the patients who got concurrent palliative care actually lived longer. One of our team members is what we call our resource coordinator, who helps patients who are identified with a serious illness who don't have medical insurance to figure out how to get Social Security disability, and whereby they then get insurance through Medicaid. We usually begin seeing patients when they're admitted to the hospital for a serious illness, and the hospitalist consults us to see the patient. It can also be provided in the outpatient setting. We have a clinic where we see patients that are able to come to the clinic and visit us. We also do home visits. We have several patients in our palliative care clinic that we've followed for years. One particularly memorable patient is a man in his late 40s who had bad congestive heart failure and didn't have insurance. Before we started to see him, he was in the hospital practically every other week with decompensated heart failure. And in the last 3 years that we've been following him, he's not been admitted to the hospital once, and his symptoms have improved dramatically.